The alternatives were either don't do any real physical activity or re-engage with sports and other activities. You don't do joint replacement unless you need it. But I think I got to the point where I was in such pain just walking, just doing routine things, that when I had that relief from that pain, it was just a whole new experience.
Hip and knee replacement are two of the most successful surgeries that we have in medicine today, and it really changes your life afterwards. It is a big surgery and it does require effort on their part, but the overall benefits that they get from it are just immeasurable. The ability to get back to all of the activities that they want to do, the decrease in pain, the overall improvement in mental mindset is just phenomenal after a joint replacement.
It was really difficult before the surgery, and after the surgery, within 5 weeks I was walking a mile every day. It was really remarkable how quickly I came back and how quickly I could do things that I hadn't been able to do before. You know, the biking took a little longer, but basically I can shop now, and that's very important to me that I can do that, and you know, life is good.
We're called the Joint Wellness Center because we focus on wellness. Our patients are not ill, they're not sick. So when they come into the hospital, it's a completely different experience than a traditional hospital stay where you're ill, you're in bed, you're in a gown. Not the way that we treat you. We get you up, moving right away, you're in your own clothes, you're doing the activities that you would do at home. And so it stands alone from other facilities that maybe don't have a program or are still fragmenting the way that things are done. We bring it all together into one group.
The joint camp model allows each of us to bring our strengths to the table and provide those strengths to each and every patient we encounter. And I really enjoy being part of the team or the framework that makes that whole thing happen.
The team approach is really key because we're all on the same page. We all know what the routine is. We all are working towards the same goal.
I think the advantages to the joint camp approach is that across the board for patients, it makes it a more positive experience. It allows the patients to take a more active role in their recovery, and therefore the whole experience becomes better.
I liked knowing what was going to happen. I liked all the information that was coming in. And everybody just made me feel like it was going to be okay.
At the Joint Wellness Camp, they tried to give it a feeling of, create a feeling of camaraderie and of encouraging one another and doing certain sessions together so you could encourage one another and see progress.
Just encouraging them, if we work on these exercises, you will get back to doing what you want to do. It may take some time, but we will get back there.
That team approach also takes the fear out of the whole process because you're very well prepared, so you know what's coming. The fear of the unknown, I think, is the worst thing that you can have. And all this prep prior to the surgery, the classes, the visits with everybody just really helps.
Because it's a group effort in combination with the patient in the center, their coach, their loved one, family member, friend, whoever can be there with them to help support them in this, along with nursing, therapy, their surgeon, everyone involved working towards the same goal, we find that when we provide all this education, we get the family, friends, coaches actively involved. They're able to return home faster. The recovery is much quicker because they've started a lot of this process beforehand.
My coach was my husband, Tom, and he was my helper. He was my cheerleader. He was my cook. He was my driver to take me to physical therapy.
I think that when you throw that word coach out, when I first heard it, I thought, oh boy. Then you realize that your job is there to help, to motivate, and to keep the patient on task.
I had a much easier time because he was there for me.
So by having a coach involved in the physical therapy department and the physical therapy aspect of a patient's recovery really allows them to see the therapist providing support and what exercise they're doing, how hard they're pushing them, what tricks they're using to kind of move the leg a little bit more, so that the coach can be a better physical therapist for the patient once they get home. And I think if they're pushing them more appropriately, patients get better more quickly.
I think anytime you make a decision to have a procedure like joint replacement, it's a big decision, and you want to be confident in the procedure and the medical staff and with all the aftercare.
Essentia Health St. Joseph's Medical Center was the first joint camp idea group therapy type model in the state of Minnesota.
We've been certified by JACO as a Center of Excellence for Hip and Knee Replacement, and we were only the second hospital in the state to achieve this level of certification. And I think it's important that patients understand that there really is no place better in the state to get their joint done than right here in their own backyard.
I enjoy telling my story to anybody who will listen, because I have come through something and I have improved my life, and I don't want to go back to the way it was.
We are improving the quality of people's lives. We definitely are.
There are a lot of success stories.
I would say that my experience with Essentia has been what I expected and more.
Everything a patient could possibly need in regards to this procedure and their recovery from this procedure is present here, locally.
I'm very happy with my knee, very happy with my life now.